Okay, so I got back a little bit ago from the hospital. Things got a little scary. My throat feels better, but it's really sore. My breathing so much better than it was for a while. I was trying to make appointments to get seen, and the nurse just heard my voice and was like, we're gonna make you an appointment, but you need to go to an urgent care now. So I went to an urgent care. They won't let you inside. I called. She heard me, talked to the attending physician. He said he recommends you get to an ER. I said, do you know where one is? She goes, ma'am, you need to go to the closest ER now. Hurry. So, didn't really help with my breathing. Started crying a little bit in the car. Chest is hurting. Feels like somebody's sitting on it. It's burning in my sternum. My breath is like, my mask is sucking in. My breath is so hard. So she uses her personal phone to find me the nearest ER and just said, hurry. So I get in, they sanitize me, go through triage. I start answering the questions. She goes, yeah, you got everything. They triage me, have me sit down, take my temperature, ask me a bunch of questions, take a urine sample, and then they're like, you need an EKG right away from the amount of chest pain I had. So they wheel you into a separate room, and I get into like a little isolated pre-treatment area, and they ask me the symptoms, any exposure, testing, and say based on everything, you're displaying COVID. And I had already had a test, and I told him it came back negative, and she said, sounds like a false positive. So they go ahead, hook me up, EKG, pulse ox, blood pressure. At that point, my breathing is still really heavy. I'm sucking my mask in. My pulse ox is normal, so she said that's good, and all the other vitals initially are good. I get an IV, I get a round of blood work. Whew. When my blood pressure starts coming in, I start to feel tingling. My feet are cold, and at one point, I'm noticing my hands really tingling, like I got shocked, like an electric shock, and it starts to turn a little blue. And I tell the doctor, and she said, that's because you're hyperventilating. We need to control your breathing. So I get a little bit more controlled breathing, calm down. Laying down is the best position. It keeps me from overworking. So they get me laid down in a bed, and then EKG comes back normal. I go for the chest x-ray, and that comes back with a spot of pneumonia. Not blasting like a lot of COVID scans, but they told me that they're utilizing the chest x-rays and the similarities of ammonia because that's the only thing they have right now to compare it to and what they say. So based on that, they went ahead and gave me like a diagnosis of COVID pneumonia. Sorry, my chest really hurts. I got on a Z-Pack for the pneumonia and an inhaler to help me with the breathing. I was told I'm in the second, one or two categories of people who experience COVID: those who get really sick and need to be hospitalized, and those who just have a shitty week. And she said, you're just gonna have a really shitty week, but your overall health is going to keep you from being out of the hospital. So if I experience anything similar or worse, really, to come back in, I have an appointment on Monday to get seen again. She said to keep that so I can get vitals. I'm quarantined for 2 weeks pending my condition and testing. They basically just said, lay in bed for the next 2 weeks and don't see anyone, don't leave, just try to rest. There's not much you can do. The nurse did tell me if I get to the point where my breathing and chest pain is similar to what I had her before, to call 911, especially since I live alone. So I got a little lecture about how people have serious problems when they wait too long. I guess I waited. The test today was the furthest and the most uncomfortable test I've had yet. I did have tears on my way home. I was trying to calm down with my breathing, and I started coughing, and I started coughing up blood. That got me a little scared. So I just pulled over with my mom calming me down on the phone, and I think it was just residual because that test really did feel like it was tickling my brain for the first time, and I've been tested multiple times. So she said false positives exist and you seem to be one of them. My experience was that it really escalated scarily quickly. So I just kind of wanted to record this for right now. I've got my medicine. I want to say all of the doctors and nurses were just really professional. I got immediate treatment. There was a system. It was efficient. It was really nice. God bless the doctor who saw me today. She's 32 weeks pregnant, has a child at home. She's coming out here kind of at high risk herself to help people. So it's people like her and everybody else at that hospital I'm just so grateful for.